topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Dallas. Welcome to another Ask the Experts. This is our 16th year of Ask the Experts. I love doing a Dallas show. We do shows throughout the country. I love doing Dallas because Dallas used to be my hometown. Went to high school there, went to college at UT Austin. My whole family still lives in Dallas. We are lucky enough to live on one of the most beautiful beaches in the state of Florida. I'm not going to rub it in. Hey, it gets really, really hot here, and we have hurricanes here, but worse things can happen. Anyhow, I want to welcome you to our show today. And we're waiting on our expert to come on. This is probably, I would say, my favorite show. And the reason why it's my favorite show is I suffer from sleep apnea. And I got to tell you, we get so many letters in from you, the listener, mostly the women, saying how their husband's snoring is really hurting their marriage. And I can understand that because I was a snorer. And my ex-wife was a major snorer. I mean, I would have to go in the other room, even though I snored too. I would have to go in the other room and go and get away from her snoring. It was so loud. Sometimes the room would shake. But I do understand those letters when people write us and say, "What do I do?" Well, this morning we have got such a great expert on with us, Dr. Smith. We're waiting on Dr. Smith. Sometimes, this is a live show. A lot of people do not do a live show. They're actually afraid to do a live show because in case there's a mistake. I kind of liked it. I like doing a live show, and we make a mistake. We make a mistake. Uh, we are lucky enough to have one of the greatest producers in uh, Rebel, so I don't even have to worry about it. While I'm sitting here talking to you, I am going to email Dr. Smith and see if he is okay. Listen, I also in Dallas, I do not forget the uh, the traffic there. Oh my God, the traffic was so bad there. It was just unbelievable. Um, and sometimes I would remember I would be late somewhere trying just to get through the Dallas traffic. It was unbelievable. I'm going to write Dr. Kent Smith now and see if, uh, just give me a minute here. I hate for to be silence on here, but I want to make sure we get Dr. Smith on because this is such an important show. And Dr. Smith he is the leader in the Dallas Fort Worth area. Um, hold on one second here. Um, sorry about this, Rebel. Uh, hold on. Is that Doc?
Yeah, I just figured I'd play a little music.
Oh, I was like, I was writing on one. What is that? Um, no, but the name I was trying to give is Dr. Smith. It's called Star Sleep and Wellness. Their phone number is 469 240 6331. Um, they have, I believe, they're up to 8 locations across the Dallas Fort Worth area. Uh, But this is one show that is so important to me because I know what it's like having sleep apnea. And I also know because I was one of those people who just let it go. And I can't believe that I let it go for so long. And sleep apnea, a lot of it is caused from high blood pressure, which I had. And it's kind of a warning sign. It's kind of something, a warning sign that God gave us that you have sleep apnea. You need to go have a medical test done. And I did, and I didn't even realize my blood pressure was so high. So I went a lot of years without uh, treating it. And so it's so important that you go on when you have sleep apnea because it is probably I'd say it's one illness and it's an illness that separates families. And one of the things I talk about on the show, what forced me to go in and get a sleep study is several times I almost fell asleep at the wheel during the day. And when you have sleep apnea, you do not get good sleep at all. So I was always tired. And then one of the most embarrassing things, I was taking a night course and I'm in a class with about 30 people. And I don't know why. First of all, I even chose to sit in the front row, but I sat in the front row and I fell asleep. And again, when you've got sleep apnea, you fall asleep, you're snoring. So I'm sitting here embarrassing the heck out of myself, snoring in class, and the teacher had to wake me up while he was doing his instructions. And it was the most embarrassing thing. So between that and several times falling asleep at the wheel, and also times when I was just talking to somebody, I mean, my eyes would start closing, and people thought I was bored with their conversation. Had nothing to do with their conversation. I had sleep apnea. And I went in and did this test. And the test was um, they put monitors on you, they put these leads on you, and they actually monitor your sleep. No big deal. It was a little difficult to fall asleep when I had probably about 20 different leads attached to me. I'm in a bed that unfamiliar to me. But the thing is, they would monitor you and tell you how, if you have sleep apnea or not. So I find out, which I probably should have known I did. I find out I've got sleep apnea, and then I have to decide how do I want to treat it. So I wear a mask at night. It's not even a mask. It's actually a nasal. I went on the CPAP machine, and you go on they test you which is more comfortable. Some people prefer a mask over their mouth and their nose. I didn't like that at all. So I went with the nasal, and it was a little uncomfortable for the first probably 2, 3 weeks. And I keep getting letters that people who are on the CPAP give it up because they say it's uncomfortable. I got to tell you, please, 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 please don't do that. You've got to get this treated. Um, so I went with the nasal, and actually, my insurance paid for a lot of it. The machines back then were probably about 1,500 to 2,000. I don't know what they are now, but my insurance did pay for that. And I got to tell you, now I cannot sleep without it. It is, um, it's a lifesaver. And a lot of the letters that we get in, a lot of the letters say that, how do I get my husband or my wife to admit that they are a snorer? Because I'm gonna tell you something, if you live with or know of a person, you might go to the movies and they fall asleep and they're snoring. They always say, "I wasn't snoring because I was that person." I know that. I would always say, "I'm not snoring." It was very embarrassing being told you snore, but you've got to just, first of all, take one step at a time. And in a relationship, uh, you just have to be honest. I just can't live this way, not getting any sleep. I know my ex-wife, even when she went in the other room, I still heard it. So you've got to be honest with your spouse. Tell them that it's hurting the relationship, and tell them how much you care about them, and you want them to get treated. And maybe they go in and find out they don't have sleep apnea. Maybe it was a nasal blockage. There's a lot of things it could be besides just sleep apnea. But the first thing is getting them to go in. Now the tests are different. You don't have to go into a sleep clinic anymore. You can do it right from your own home, which, oh my God, that would have been so much better. I think we're getting Dr. Smith now. Um, it's so much better now because you go in with, you can sleep in your own bed now. But I got to tell you,
Sorry to interrupt, Steve. I need to try to bring Dr. Kent on. I see him backstage. Well, I don't see him backstage. I see this. Dr. Smith, can you hear us? And can we hear you?
I can hear you. Can you not hear
I,
me?
We can hear
we
you.
can
We
hear
just
you.
can't see you.
Let's see what's going on here. This is unusual.
Do you possibly
That's
have
it.
a slide over the camera? Something that blocks the camera from being seen?
Oh, yeah.
That's what it's
Something.
indicating. Camera has a slide or a vent, some sort of cover on it. That's what it indicates. Not
It's usually at the
necessarily.
top right by the camera where the camera light is.
Oh,
There
that
you
switch
go.
got
There he
switched
is.
off. Yeah, I don't know how that happened, but I was out of town teaching this weekend and the camera got switched off. And I had this at 9:25, but okay, I'm here. So
Well, you know what? I tell you what, I've got so many questions, Dr. Smith. Man, Rebel, can we go the full hour?
Yes, we can.
Okay. In other words, we've already gone through about the first 15 minutes. So we'll keep you on a little bit longer. We've got so many questions. Dr. Smith, I've been telling people because I'm not afraid to admit it. I have sleep apnea. And I told him this is actually my favorite show. All my family lives in Dallas, but I understand there's not too many of my shows we do. We do 35 shows a month. Not too many of the shows I do, I actually is dear to my heart like this one because I know what people with sleep apnea go through. And I also know how they procrastinate. Dr. Smith is shaking his head. And I
Very good.
also know how bad this is for relationships. So, guys, I'm one of you. I've been telling them that Star Sleep and Wellness is without a doubt. I've known this for so many years and wanted to get Dr. Smith on our show. So, Dr. Smith, first of all, I'm so glad you're here. And, it's probably my fault. I got it mixed up on times. So, tell people about Star Sleep Wellness.
Sure. Yeah. So, yeah, we've been around for 25, 30 years. We brought on some sleep physicians that had been around 40 years. So there's a lot of experience. We can treat all kinds of sleep disorders. The most common one is, of course, sleep apnea, which you've referenced. Snoring is just a precursor to that. So we believe that everybody who snores should have a sleep study because you just don't know what's going on. And like you said, people procrastinate. They think, oh, this snoring is no big deal. It's not going to affect my health, but it very well can affect your health. It's just like taking your blood pressure periodically, getting mammograms. Yeah, you spend a third of your life sleeping. And if you don't test that every once in a while, you're doing yourself a disfavor. So, and there's also something called silent apnea. So you can even stop breathing when you're not snoring. So there's lots of reasons to just periodically check the health of your sleep. So we're big proponents of that. Hopefully you don't need treatment, but if you do, it can save your life. It can save your marriage. It can save your relationships. It can save your career. People fall asleep at work and get fired for it. I mean, this is a huge issue for many people. And we've got 8 locations and we're growing. And we've got now a research team on board that is studying a lot of things that need to be studied in the area of sleep.
Wow.
So what's
I
going
didn't know
on?
that.
Yeah, no, that's
Wow.
pretty good.
Listen, he didn't know this, but we've talked about on the show before. I have known about Dr. Smith the last 15 years. You actually started as a dentist.
Yep.
And now I look at your practice now, how it's grown over the years. We've had a lot of people who saw your shows coming on wanted to know about your locations. And I think we'll probably start in the future, start putting all your locations up. But just go over all your different locations you have.
Sure. Hopefully I can get them all.
They're your babies.
No, once we get to 50 or so, I'm going to forget them. But for now, yeah, Irving, Frisco, Denton, Dallas, McKinney, Mansfield. How many is that?
6.
6. Houston. Sorry.
Oh, yeah.
Houston. Yes. And then North Carolina, we just opened.
Wow. You're not in Plano at all? What's the
No, we were in Plano. We may get back into Plano, but we shut down that location to merge it with another one. But yeah, Plano, we're not there. What's
the closest to Plano?
Well, it could be either McKinney or Frisco.
Okay, well, those are close.
Yeah,
those are both close. I don't know why we get all the letters, but I'm glad you sent them to us because I understand your questions. And here today, I want people to know that there is relief out there. Like you said, your marriage, your health. I mean, my high blood pressure is had a lot to do with my sleep apnea,
Yep.
and I wouldn't have known it. And this is something I guess, Dr. Smith, I just don't want people to procrastinate like I did, especially when you've got so many locations. And now you can do the sleep study right from your own home.
Yep. I mean, we take every medical insurance, including Medicare. I mean, it's especially in the end of the year like this, where I'm not sure when this is going to show, but honestly, the
We're live.
deductibles for many people have been met. It would be
Yes.
essentially free to get tested and treated. Maybe you just need to make a New Year's resolution early and get this tested and treated, and you'll do your family, your bed partner. They're all going to be happy if you get this treated.
I want to tell people about Medicare. Um, my Medicare paid for everything.
Yeah.
They paid for the machine. And not only that, but they actually, what mine does is, I guess it's every 3 months, you can get new nasals or mask or anything your machine needs. I mean, it's all part of your Medicare. And I went in for a sleep study about 3 years ago, again, because they wanted to see if my sleep apnea had progressed, and it paid for everything. So if you're on Medicare, Medicare takes care of everything.
Yep. It sure does.
It's
And now a lot of
what
people have these Medicare Advantage plans now, which is a
Yes, that's
little
what I have.
different. Yeah. But that again, there's a deductible there that you don't have with traditional Medicare, but it's definitely even less expensive with the Medicare replacement plans like that.
Well, I got to tell you, we got a lot of questions here. Let's get to the questions. Uh, Dr. Smith is usually here. We try to put him on the last Tuesday or Wednesday on his live show, and then we replay it throughout the month. Let's start off with John in Pleasant Grove. I'm getting homesick when I hear these names. Uh, just found your show. What is your preference, the CPAP or oral appliance, and how does each work?
Yeah, the oral appliance, they've both been around for a long time, but the oral appliance just gently brings your jaw forward, holds it in a position that keeps your tongue from collapsing against the back of your throat. And it's kind of like two retainers at the same time. The advantages to that are it's easier to wear, easier to travel with, easier to clean. You don't have any replacement parts to it. It'll last 5 years, 10 years, whatever. And there's lots of different designs, and just depending on patient preferences and what their mouth looks like, how many teeth they have, all those kind of things. So you do need to have some teeth to support that.
Right.
All right. So the CPAP, on the other hand, is meant for more serious apnea. It's meant for people who typically severe and above. I mean, because to be severe, you have to stop breathing 30 times every hour. Every 2 minutes, you stop breathing for at least 10 seconds. So these are extended periods of not breathing, and there's a lot of times per hour that you do this. So the severe apnea cases, 30 and above, typically we will suggest a CPAP machine. Now, some people can't wear it, but it's very effective if you can wear it. It's about 50% of people that are able to wear it, but if you can wear it, it's fantastic. It works great. So it really just depends on what you think you would want to try first and what your diagnosis is.
I think if a person who needs to go on a CPAP machine will just use it for at least a month.
Yeah.
You just get used to it. I don't even notice it at all. It's not, to me, it's not cumbersome at all. Dr. Smith, I want to kind of give a warning out to people because I tried everything. When you hear you're a snorer, you hear all these ads online about, this will make you stop snoring. I got to tell you, I tried all of them from the little piece of tape on the no, and I got to tell you, and maybe you might know different, but none of them worked. It was the biggest waste of money.
Yeah, I mean, if there's very mild snoring, just every once in a while, maybe something like the nose strips, elevating the head of your bed can help so that you're not laying flat, sleeping on your side rather than your back. And then, yeah, there are even some, I won't go into any names out there, but they're marketing. Tell you what, we'll send you an impression kit. You can take impressions of your own teeth in your house, send it back to us, and we'll make you an oral device.
Wow.
Uh, Even our team members who have taken, well, we use digital scanners now, but which are much more sophisticated and more accurate than taking a gooey impression that we used to do. But that's what they're advocating. Even if I have an experienced team member who has done 1,000 impressions, they have to retake quite a few. If it's not just perfect, the appliance won't fit. So we get these, you call them over the counter, or these do it yourself at home DIY appliances that people are doing. It can be a problem because they bill your medical insurance, then that's used up. You can't bill medical anymore for that. And you've got an inferior appliance that doesn't fit. We have people coming in and just throwing them at us and saying, I can't believe I fell for this, and I never want to wear one of these things again. So you just have to be careful. You're right.
Yeah.
It's a good warning sign for you.
Yeah, here's one of your patients, Jack and Garland. He said, I just got my machine in and I found your show because I wanted to do as much research as possible. Do I have to fill the humidifier?
No, you don't have to, but most people prefer it. I guess you probably use one, Steve-O, humidifier.
Yes.
Yeah. So using it is preferable. It just keeps your mouth from drying out because this is room air. It's coming into the machine. It's filtering it and preparing it for your lungs. But if it's too dry and not moist enough, you might get a dry mouth. I have some patients that just prefer not to use it. Most people, though, prefer to use the humidifier. And so you do need to fill it. Distilled water is preferred. You can use other water, but if you can get distilled water, that's really the best for the machine.
Okay. Judy in Plano, I think my husband has sleep apnea. We cannot even sleep in the same room. I know, Dr. Smith, you hear so many stories like this.
Right.
What are the symptoms of sleep apnea, and how do I get him to come in and see you? It's hurting our marriage.
Yeah,
You hear that's a
that's
common story.
that's very common. Yeah, I mean, you mentioned high blood pressure already. So hypertension or high blood pressure is just a precursor. I mean, if you have high blood pressure, and especially if it's not controlled, there's a good chance of you having a heart attack. And you don't want that. And your husband doesn't want that, I don't think. So, yeah, and there's other complications. Obviously, diabetes, acid reflux is very common with untreated apnea. You're much more likely to die in the middle of the night, sudden cardiac death. Just 3 o'clock in the morning, you're gone, and nobody knows why. It was very strange. He was healthy. All he did was snore. Well, yeah, snoring and the apnea that accompanies it can put a big strain on your heart and the muscles around your heart. So it's just, it can't be underplayed. You've got to get this diagnosed and treated. And I don't know how to tell your husband to do that, but you know him a lot better than I do. So all I can do is say good luck, because it's not easy to get males, especially, to worry about their health, which is really bad.
Yes. Yeah, I also one of our, I guess one of your new patients now is doing a lot of research. If you research this, you're going to find out all the negatives that can happen to your health
Oh
by
yeah.
not treating this. And use those. If you listen, if you have to scare them to come in, it doesn't matter. Um, but it is, I got to tell you, it's so easy and so it's inexpensive if you've got any kind of insurance. And I got to tell you, you're if others are like me, where I fell asleep during a class and the teacher said you're snoring, wake up. That is embarrassing. And or if you've I always think I've told Dr. Smith this before, whenever I hear about an accident, someone going off the road, think about people falling asleep at the road because I was always tired, Dr. Smith, always.
Yeah, it's dangerous out on the highways. Knowing how many are undiagnosed and untreated, 85% of everybody that has apnea has not been diagnosed, has no idea they have it, or they're scared to get it diagnosed and treated. So
Right.
if you think about that, there's a lot of people out there driving that could fall asleep behind the wheel, pull over into your lane from the opposite direction, and you guys could have a head-on collision. Now, you don't want to be that person either. You don't want to be the one that falls asleep. So, yes, the roads are dangerous for that reason, but you should really, if you're the one, yeah, you need to get the 85%. If you're a part of that 85% of the population, please get diagnosed and treated.
Is that what it is? 85% of the population suffer
Yeah.
from sleep apnea?
They did the research 40 years ago, and at that
Wow.
time, it was 85%. They did more research 5 years ago, it's still 85%. So we're doing a
Wow.
very poor job of diagnosing patients, and I'm gonna say it's our fault. We have not communicated properly to the communities that they need to get this looked at and treated. Now, the Inspire commercials are doing a pretty good job of that. They've got $1 billion behind them, and they're marketing the Inspire, but that's surgery, and we feel like surgery should be the last resort. You should try other things before that, but at least they're raising the level of awareness, and we appreciate that. So any communication we can get, stuff like this radio show, I really appreciate this, and anything else that we can do or anybody else can do to raise awareness will help save a lot of lives.
Well, one of the nice things about being on YouTube and iHeart and Spotify and so many we're on 70 platforms, is I've noticed that so many people go and listen to your show after your live show was run. They've gone back and listened to it, and the numbers keep going higher every month. So it's like people now maybe are starting to realize that maybe I should do something about this. And I'm going to say this again, and it's not because Dr. Smith is an expert. I knew about Dr. Smith probably 15 years ago when we started the show. He had a great reputation back then. So you can imagine what is now. And listen, every time you tell me you're opening up a new location, I feel like, hey, that town is so lucky because they have someone close by. Let me go to this is something I've never heard of. This is Lane in Plano. He wants to know, I've been doing research and I found what is obstructive sleep apnea.
Well, that's really what we're talking about. Obstructive sleep apnea is where there's a blockage of some kind. So it can be, and most often it's the tongue. The tongue falls back against the back of your throat, shuts off the airway, and you're trying to breathe, but there's an obstruction. So that's why they call it obstructive sleep apnea. The other brand is central sleep apnea. With central sleep apnea, your brain doesn't send a signal to the respiratory center to tell you to breathe. So you don't even try to breathe. There could be an obstruction, but typically in these situations, you could breathe if you tried, but you don't even try because your brain has an issue that needs to be trained. And sometimes you have to use a special kind of machine for that.
Do you treat people who can't fall asleep?
Yeah, that's just sleep onset insomnia. There are 14 different types of insomnia,
Well,
but that's the one that most people struggle with. So we do treat that, yes. We love to use CBTI, which is cognitive behavioral therapy for insomnia, to kind of train your brain to shut down and stop thinking about everything. That's what most people complain about. They just can't shut their brain off.
right.
So that's a therapy that helps teach you how to do that, and you learn on your own how to initiate sleep. If that doesn't work, then medications are necessary.
Let's go to Bill in Fort Worth. How much sleep do we need? What about those who tell us they only need 4 to 5 hours of sleep and they've been doing that way their entire life?
Well, there's a small chance they're telling the truth that they don't need it. There are certain people with a defective clock gene. And when you have a defective clock gene, that allows you to get by on less sleep and not severely impact your health. Most people need 7.5 to 8 hours. So I would certainly suggest everybody listening to this, watching this, should certainly get 7.5 to 8 hours every night. And it should be consistent. It should be the same every single night of the week. You don't want to get 5 hours on the weekend during the week and then get 10 hours on the weekend. You can't make up sleep like that. You may feel like you need to, and yeah, you probably should if you only got 5 hours of sleep every night, but it is impacting your health and will increase your weight. You'll have weight gain if you don't have the same hours of sleep every night. There's lots of research behind all these things. Just do the research yourself online and you'll find peer-reviewed scientific journals explaining every bit of this.
Yeah, I've heard that if you don't get at least 7 hours sleep, that it could cause weight gain. So that really is true, huh?
It is true. Yeah.
Wow. Okay, let's go to Trey in Mesquite. Is there such a thing as unhealthy sleep? And what does that look like?
Yeah, I mean, there's a lot of ways you could define unhealthy sleep. The one we've been discussing, obstructive sleep apnea, creates the
Yes.
most unhealthy sleep. Because in sleep, you should be resting, recuperating, recovering from the previous day, preparing your body and mind for the next day. The problem is if you have any type of unhealthy sleep, and that could be insomnia, you could have a lot of waking episodes. You know, too much caffeine during the day can create those. Alcohol right before you go to sleep can cause issues like that. Um, Unhealthy sleep is just where you don't, when you're 20 years old, you would go to sleep and the next thing you knew, you would wake up and that would be it. Was the healthiest sleep back then. But as you age, it's more difficult to get healthy sleep. And you just have to pay more attention to it, just like you have to do in a lot of your health problems. I mean, when you go to the doctor, they're testing you for all kinds of things. I wish they tested you for sleep and suggested you get a sleep study. I would suggest the next time you're at your physician and they're doing a full complement of testing, say, why don't you ever test my sleep and see what they say?
Yeah, that's right. That's right. Um, Here's Joe in Saxe. God, that's our first Saxe we've gotten. I want to know if I snore, does that automatically mean I have sleep apnea?
No, it doesn't. Again, you have to stop breathing at least 5 times an hour for 10 seconds each time to be considered to have apnea, and that would be a mild form of it. So there are snorers that do not have sleep apnea, but if you're depending on your bed partner to tell you that you stop breathing, bed partners are terrible diagnosticians. They cannot tell that. You really should just get a sleep study to just make sure the snoring has not turned into sleep apnea.
Here's Latilia in downtown Dallas. Thank you for bringing us such a great show. I am calling on Monday. I'm a little nervous. Can you tell me how the sleep lab works? Is it overnight?
Well, we rarely have to send somebody in for an overnight sleep study in a sleep lab. 99% of the time, if not even higher than that, you just go home with the unit that you can put on. We'll show you how to put it on. It's typically not even in your nose or anything. There's not a bunch of wires to hook up. Diagnostics have improved so much that you will have no struggle with the type of sleep study that we give you.
I've got 3 or 4 knobs on my machine. I have no idea what they are. Uh, does the machine have to be
Calibrated?
calibrated at all?
Yeah.
Yeah.
I mean, you should get it checked every few years just to make
Okay.
sure. I mean, ResMed and some other manufacturers have a portal. They can see exactly if the doctor that prescribed the CPAP is paying attention, they can look at the portal and they can see if it's still effectively treating your apnea.
Wow.
Unfortunately, most sleep companies and sleep labs and physicians don't check this because it takes time to look at the portal and to look and check every patient that you've treated to ensure that it's being treated effectively. That's one thing that we call it. We have a recovery team is what we call it. And that's exactly what they do. They go to the portal, they make sure things are working like they're supposed to. And if they don't, then we can remotely change the settings on your machine. Actually, you don't even have to come in.
Wow.
Yeah, technology has come a long way.
Amazing.
Yeah.
Uh, Here's John in Plano. I just found your show today. I can't believe someone's finally doing a show on sleep. It's reminding me I need to come in and get checked. What is REM sleep? Is that the same thing as deep sleep?
No, it's a common misconception. It's not. Deep sleep is where we recover from the previous day. It gives us a rosy outlook on life. There's a lot of important reasons why you need deep sleep, and deep sleep is the first thing that untreated apneics lose if they don't have if they're because every time they get into deep sleep, their obstructed breathing wakes them back up out of deep sleep into lighter sleep. REM sleep is what helps us process memories. Primarily, that's what it's for, but it's also essential for life. You have to have REM sleep, and it's a very active brain because that's when you're dreaming, that's when you're having nightmares, that's when you're creating. You're doing a lot of things in REM sleep that you don't do in the other phases of sleep. So REM sleep, let's just call it your creative sleep, and deep sleep is restorative sleep. Probably the best way to think about that.
Ooh, here's a good question. We just got a text from Cindy in San Antonio. I just found your show today. I saw the YouTube prompt. Uh, I am wondering, is there any way that you can treat somebody from another city, or do they have to come in to see you?
Yeah, there has to be at least one visit. But if they will contact me, I'll get them some help in San Antonio. I have some contacts
Oh,
there and I can get them some help. Yeah.
yeah, but see, the problem is, Dr. Smith, you do such a great job on this show, they don't want anybody else.
Well,
They want your company, your clinic anyway.
one trip to from San Antonio to the Dallas
Yeah,
area won't be that bad. And maybe Houston's closer. I don't even know if Houston or Dallas is closer to San Antonio. But
I I got to tell you, you know what? I'm telling you that whatever the case is, you got to get this treated. We just got a text in from someone who just joined the show because we talked about this before. Um, let's just do it again because people joined the show late. What are the negatives of sleep apnea?
the negatives are numerous if it's untreated. Okay. So if it's
Yes.
treated, it's like you don't have it. Okay. So Now, if you go for a long time and you develop cardiovascular disease, hypertension, diabetes, depression is very common with untreated sleep apnea. So if you develop these cases, sometimes it can't be reversed. If you damage your heart, it's not going to undamage your heart. It's not going to heal it, but it can prevent things from getting worse. I would say that there's not a good reason not to treat untreated sleep apnea. That's a blanket statement. There's nothing against that at all.
You know, it's amazing, Dr. Smith, that um, God gives us so many signs that there's a problem. Um, like reflux,
Yeah.
is one of them. High
Yeah.
blood pressure. There's so many signs you're given, and we just want to go about our day and maybe think it's going to go away or no big deal.
I mean,
And
do you like to be sleepy during the day? Is that something you
yeah,
enjoy? Or would you rather have more energy and be able to do things and play with your kids and grandkids and go out with your friends and stuff? But if you lack energy, if you just can't get off the couch, again, lots of things can impact you if you don't get this treated.
and again, a lot of this is covered by, I can only speak to Medicare. A lot of this is covered. I know there's open enrollments coming up uh, next month, I think the 10th, and make sure that you get a policy if you think you might have sleep apnea that will cover this because I mean, like I said, my policy covers everything. I
Well,
mean,
all Medicare plans cover it. The Advantage plans, the replacement plans, including primary Medicare, it all covers it. But also, it's rare to find a medical insurance outside of Medicare that doesn't cover it. They all cover this because they know if they treat it. They did a study, the DOT, Department of Transportation, did a study a few years ago that said if they treat somebody, they will only pay $1 compared to paying $3 if they don't treat it. So it made sense for them to make sure that their truck drivers are getting treated because untreated can cause wrecks, can cause delay in shipments, all that kind of stuff. So, yeah.
yeah, that makes sense.
Yeah.
We've got a few more minutes. I want to let you just whatever you feel you want to say is tell people why they should come to Star Sleep and Wellness if they think they have a sleep or a snoring problem or possibly sleep apnea.
Yeah. For one thing, getting somebody to pay attention to their health is tough. And, you probably have a brother or a sister, a dad. I hear this a lot. Somebody's father said, well, sleep apnea wasn't around in his day, so he just says he's not going to get it treated. Even if he's 85 years old, the oldest person we've treated was, I think, 94. So
Wow.
you're never too old to get this treated. It's something that, I if you don't have this problem, just keep your ear out for people complaining about sleepiness and heart disease. If you've got any relatives that have heart problems, well, my grandfather died at 58, my dad died at 59, I'm going to die at 59 anyway from a heart attack. No, you can prevent that.
It's so important, your words. And like I said, I have sleep apnea. Some people are afraid to admit it. I'm not. I mean, I want people to get treated. We're, you know, we never know who's listening to the show or watching the show, but, we're giving you a clinic that is the top clinic in the country. Not just, I'm not saying just in Dallas, Fort Worth, but I would say in the country.
Well,
And
we've learned recently we're the largest in the world. So yes, we are.
are you really?
Yes, we
All
are.
right.
Yes.
And I remember you with when. That's amazing.
Yeah,
Oh, let's tell people. Do you have a number that's good for all your locations, Dr.
I
Smith?
do. It's on the screen right now. 844-409-4657. That goes to our central, regardless of where you want to go, what location you want to go to. That's the number you will call. 844-409-4657.
And we will be replaying the show throughout the month. Dr. Smith, thank you, my friend. We'll see you again.
Sounds good. Thank you, Steve-O. Have
Thanks,
a good
Dr.
day.
Smith.
All
You
right.
too, bud.
Bye-bye.
That's Dr. Kent Smith. Hey, I'm glad, he was late coming on, and that might have been my fault. But it's so important that if you have sleep apnea or a snoring problem, you get it treated. Hey, that's it for us today. We'll be back again with you next week with more Ask the Experts. Thank you, Rebel.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.